Hello, my name's Eleanor and I'm going to be discussing a new bedside test that could put an end to some causes of preventable deafness. Every year, hundreds of babies become deaf as a direct side effect of the emergency antibiotic gentamicin. This is given to babies when they are really unwell with things such as sepsis. 1 in 500 babies carry the mutation that leaves them profoundly, irreversibly deaf. And every year this antibiotic is given to 100,000 babies. This means this new test has the potential to save the hearing of hundreds of them. Now, although this mutation has been known about for a while and genotyping has existed, it has taken several days. This leaves the 1 hour time period that babies need to be given that antibiotic in to be effective redundant. However, this new test takes just 25 minutes and uses a cheek swab that may look quite similar to the COVID tests I'm sure we're all familiar with. It can be done at the bedside by nursing staff, and it means an alternative antibiotic can be given if the mutation is found, meaning the baby's life is saved and their hearing is preserved. This amazing research was led by Professor Bill Newman and his team at the University of Manchester Foundation Trust, and is just one example of how genomic medicine can revolutionise healthcare. Now, it uses something called a gene drive, and admittedly these aren't cheap. However, it has the potential to save the NHS £7 million a year, and this is because once babies become profoundly deaf, they generally require some really invasive and costly procedures down the line. This is something like a cochlear implant. Although this is exciting in the UK, I'm really excited for the potential that it has to go worldwide. As of the 7 million babies that receive gentamicin every year, the majority are in low and middle income countries. This means these locations have a higher proportion of deaf infants because of this antibiotic. It is worth bearing in mind as well that these places generally have poorer health infrastructure and education systems when compared to the UK. This means these babies may have a more tough time down the line compared to their UK counterparts. Not only does this combat the United Nations' 3rd sustainability goal of better health, but also the 10th, reducing inequalities. That concludes my talk for Talking Science, a Healthier World, and hopefully a hearing one. Thank you for listening.